The World Health Organization says the Israeli military has attacked its staff residence in Deir al Balah and has called for the immediate release of a staff member who they say has been detained. Israeli forces are on the ground for the first time in the city, believing hostages may be there. Joined now by Tarek Yasharevich, a spokesperson for the World Health Organization. Good to have you with us and thank you for sharing your time. Just talk to us about this incident. What do you understand happened?
Well, what happened is that the house, the residence of our staff has been attacked, first with explosives, and then Israeli military personnel went in. They ordered women and children to depart on foot, and then they interrogated, stripped and handcuffed all the male persons who were there. Then 4 people were detained. 2 of them were our staff. 3 of them were later released, but 1 of our staff is still being detained. What also happened is that 1 of our main warehouses has also been attacked. So all this means that that our operations are becoming more and more difficult in an already catastrophic situation in Gaza, where people are under constant bombardment, under constant evacuation orders, and where hospitals cannot provide medical care.
And Tarek, I assume that your residences, your warehouses, etc., are all flagged to the IDF, to the Israeli military. They know what those buildings are, they know what they house and the services being operated from them.
Exactly. All our premises, coordinates are being shared with all the relevant parties. And it just shows how difficult it is, not only for WHO, but for all humanitarian actors to provide humanitarian assistance in the situation where there is a nearly complete blockade on Gaza, where fuel cannot come in, where medical supplies cannot come in, where food cannot come in. People are hungry, people are sick, people are dying, and we as humanitarians are not able to do our job.
You say that one of your staff members is still being detained by Israeli forces. What allegations have they made? What claims are they making? What reasons are they giving for doing so?
We don't know that, but these persons should be released, like all the UN personnel that have been detained from other UN agencies as well. And again, let's not forget health workers who are not UN employees and who have even less protection. 330 health workers are being detained by Israel. 1,500 health workers have been killed so far. So what we are seeing really is a pattern of dismantling of health system.
It makes no difference, Tarek, but it's useful for our accuracy in our reporting. The individuals who were detained and searched, are they local employees or are they foreign aid workers who you have sent to Gaza?
Well, we are trying not to differentiate. This person in question is a national, but we are having problems of bringing in international medical workers who are ready to come to work in Gaza. Just since March this year, 58 international health professionals, including surgeons and those with a critical medical expertise, were denied visa to come and assist the population of Gaza.
No, I appreciate not wanting to make the distinction, but also useful just to get the full facts where we can. Just talk to us, if you will, about what level of service you're currently able to provide. What is the WHO managing to do on the ground at the moment, and how much is being restricted?
Well, the situation is really catastrophic. Our role is to support existing health services. The problem is that those health services are not existing anymore. Hospitals run out of most of medications. There is no fuel. Hospitals cannot function if there is no fuel, and fuel has not been able to enter Gaza for months now. People are being injured on a daily basis. People who are simply desperately going to get some food are being shot, and then they cannot receive the medical care they need. We are not able to evacuate those who may receive medical care somewhere else. So not to speak about pregnant women, about children that are malnourished. So really, it's a desperate situation. People are hungry, people are sick, people are desperate. And unfortunately, there is no humanitarian space allowed to WHO and others to provide support.
When you see what you've seen, when you describe what you've described, how hard is it to retain hope?
Well, if you wish, I'm saying these things for almost 2 years now. We are calling for ceasefire. We are calling for political solution that will allow to bombs not falling down on people in Gaza any longer. Unfortunately, we have not been successful in that. What we can do as humanitarians is keep pleading really for the peace, for the ceasefire, for the humanitarian access by showing what is really the fate of people of Gaza right now.
Spokesperson for the World Health Organization, Tarek Yasharevich, good to have you with us. Thank you.